We've got with us right now Dr. Kevin Kavanagh. Hey, good morning, Dr. Kavanagh.
Hey, good morning, Jack.
Have you heard anything about this?
Seed packages from China? No.
That's a thing, apparently. As I mentioned, Ag Commissioner Ryan Quarles tweeted out the information last night. Now, it could be and probably is a hoax, but, you know, these days and times, you can't be too careful.
Well, tell me about it. I haven't heard. I just picked up the last part.
Yeah, just people are getting these seed packages that are labeled jewelry, and they intentionally have done that in order to get people to open them, and there are just seeds in there. And apparently some people have actually opened the seed package and planted the seeds, and they're suggesting that Americans who receive anything unsolicited like that, seeds or anything else, just don't mess with them.
Well, I'd agree with that.
And it may be a hoax, and it may just be somebody trying to make. I don't know what it is, but we'll certainly look into it. As far as the latest are concerned, Dr. Deborah Birx, who's a top spokesperson for the Trump administration on COVID-19, stopped in Frankfurt on Sunday, right?
Correct. Yes.
And what happened?
Well, she related that Kentucky probably needs to consider a partial close down of bars and restaurants, at least the indoor component. Restaurants suggested scaling back, bars closing, limiting social gatherings to 10 people, and that 100% of the people need to wear masks. So besides the issue of whether or not things are legal or whether or not person says this or that or who's the right person to do this, forget that. People just need to look at the virus, wear the masks. And this is very important. This is our best weapon that we have to delay this pandemic. Remember, there's a vaccine that's coming in the pipeline, and even sooner than that, we should have by at least the end of September a serum that will be able to kill the coronavirus. And I think that the serum is key. So I would really, really suggest that people follow social distancing, try not to get the virus, and for goodness sakes, don't get our healthcare system overrun, because then the fatality rate will skyrocket on this.
Did you see the picture of Dr. Fauci sitting in the stands of that opening baseball game, talking to a guy to his right and I guess it's his wife to his left? No spacing, and Dr. Fauci had his mask down under his chin.
Well, I didn't see that, but I've seen some other pictures like that, that every now and then everybody has lapses, and that's the thing. You know, you try to do everything 100%, and you wind up lapsing when you're not thinking. You know, you live your whole life one way, and you're expected to wear a mask 100% of the time. It's very hard to do. But that's different than intentionally, I think, not wearing one or planning on going into a retail establishment that's requiring masks and making a stand that, hey, you know, I'm not going to wear a mask. And in doing so, you're putting everybody else's life at risk. Not so much your own, but everybody else's. So that is something that I think we really need to stay away from. Our cases are going up, our positivity rates going up. And as I've discussed repeatedly before, it's not going to be safe to open up schools if our cases are skyrocketing. So we really do need to get this under control.
Governor, we're going to make him a doctor now. Governor Beshear has suggested, not mandated, but suggested that churches go back to virtual meetings for 2 weeks. And that has some people shook up.
Well, I think that any sort of indoor gathering needs to be curtailed until this virus is under control and cases are driven down low enough that you can do adequate case tracking. But that just doesn't include churches. That also includes scaling back in restaurants. New York City, I don't believe, is still allowing in-restaurant dining. In other words, indoor dining. And bars. To me, bars are more dangerous than churches. Bars should be closed at this point. I said that several weeks ago. And certainly if you're asking churches to curtail, I think you really need to consider doing the same for bars. And I feel that's going to be one of the things the governor may mention this afternoon.
Yeah, I was going to say he's going to have some new announcements today. Do you have any kind of handle on what they might be?
Just speculating, but I would really think that bars would be included in there. I would hope that these are mandates as opposed to suggestions or recommendations. And I know that people get up in arms when you say that, but not so much that they have to be enforced, but it does relate the seriousness of the situation. When I was a younger man and into the issues of tobacco and whether or not you should use tobacco, I remember giving a lecture at a high school. Well, no, it wasn't. It was a middle school, and talking about the dangers of tobacco. And one of the questions from the students was, well, if it's so dangerous, why isn't it illegal? And so that's a problem, is that there's an overall perception that if it's not illegal, it can't be that bad. So even if you can't enforce the mandates and the public hasn't completely bought in, it does relate a seriousness to the situation. And I don't care whether it's the governor that does it, whether it's the state legislature that does it, whoever does it, they need to make a real statement that people need to wear masks.
What else do we need to know this Monday morning, Doctor?
Well, just everything is really on track to us having big cases if we do not social distance, wear masks, wash our hands, that there's a lot of things medicine can do to treat this virus if beds are available. So we got to keep rates down. And within the next few months, I think that we'll have some very new exciting treatments to really get this virus under control as far as preventing it from killing you. And we need to remember that surviving the virus isn't the same thing as recovering the virus. People get very sick. We're not sure how long that lasts. So even the young need to be very careful on getting this. So there is some good hope that is on the horizon, but also right now we're in a very cautionary period where we really do need to follow public health advice.
Dr. Kevin Kavanagh, thank you so much. We'll talk to you Wednesday.
Thank you, Jack.